Well, here in France, the number of patients admitted to hospital intensive care units with Covid-19 has now reached the same levels that we last saw here in November. Well, earlier I spoke to leading epidemiologist Catherine Hill, and I began by asking her if France had more vaccine doses, how much better would the situation be?
Yes, obviously, but we can only use the doses that are available.
Do you think France would be in a better position when it comes to the vaccine rollout if you'd done what Britain did and not take part in the EU effort?
I don't think that was an option, and considering the way the government has handled the situation, I'm not sure they would have done better than what the EU has done.
So what did the government get wrong?
What they got wrong since the beginning is the not understanding that the virus goes fast. And if you wait until people have symptoms, they already have been contagious for a few days. 17% of the population has had Covid-19 in France, and they only have found altogether about a third of those cases.
Right.
So the system is missing most of the cases, and they are working very hard to find the contacts of the case they find, but they never realized that they were finding only 1/3 of the problem.
Decision over AstraZeneca, saying that it was unacceptable, quasi-ineffective for people over the age of 65. Was it political payback?
I think he's following bad science and following the politics. He said that AstraZeneca vaccine was no good over age 65. That was a gigantic mistake.
Are you worried about vaccine nationalism, about vaccine jealousy?
Vaccine manufacturers are doing their best to produce vaccines, and of course there's a little bit of problem if this country pays a little more than that, then some richer people are going to win, but there's going to be enough vaccine at the end. So it's just a question of slowing down things a little bit here than there, but it's not so important. It's just agitation.
Catherine Hill, thank you very much. Well, as we heard earlier, there's been a bit of a row between the European Union and indeed the UK about coronavirus vaccines and their exports, with really the UK hitting back at Brussels over a claim that the UK had imposed a ban on such exports. Well, joining me now is the German GP and MEP, Peter Liese, who sits on the European Parliament's Vaccine Advisory Group. Thank you very much for coming on the programme. What exactly is your issue with Britain here?
So the Council President Charles Michel was not correct when he said that there is an export ban. That it's not the case, but there is a UK first policy, like there is a US first, America first policy in the United States, which means that especially the AstraZeneca vaccine is not delivered from the United Kingdom to the continent, while on contrast, not only the BioNTech Pfizer vaccine frequently comes from Germany and Belgium to the United Kingdom, but also many doses of AstraZeneca vaccine came until January from the continent to the United Kingdom. And this is an unfair situation. And while Charles Michel was wrong in his precise wording, he's right in pointing out that there is a problem.
But why pick on Britain? I mean, last week, Italy banned the export of 250,000 doses of AstraZeneca to Australia. The European Union gave it the green light. That was clearly an Italy first, EU first policy, wasn't it?
No, we are seeing a situation, and I have to defend this to my voters in Germany, that we are exporting and exporting and exporting. Last month it was 25 million doses, including 9 million doses to the United Kingdom, and we cannot vaccinate our people fast enough. So European Union is for cooperation, we are for open borders and for collaboration, but if the United Kingdom doesn't export, you call it an export ban, or it is linked to the treaty, and if United States don't export. So we cannot let our people without a vaccine, and that's why it's high time to react.
Right. But I wonder if you're picking on Britain because of Brexit, because we also know that the European Union, or rather companies in the European Union sent 3.5 million doses to Canada and 2.5 million doses to Mexico. And I haven't heard you kick up a fuss about that.
So personally, I would not exclude a complete export ban. We have the problem that we cannot vaccinate our people fast enough, even though we produce a lot of vaccine in Germany and Belgium mainly. So when I speak about an export ban, I speak about a complete export ban. But on the other hand, we are all interlinked, and I think we need to work together. And when Boris Johnson was in the conference last May with Ursula von der Leyen, he said, we are all in this together, but at the same time, he signed a UK first contract. So there is a problem.
All right. Okay, got to leave it there, I'm afraid. Dr. Peter Liese, thank you very much for coming on the program.